emotion and all that to go along with it. So if any of you are out there, you know what I used to be about a little 12 years ago. I really didn't believe that my headaches were probably due to nutritional deficiencies or whatever. And I learned that, you don't have to wake up with a headache and go to bed with a headache. And Dr. Nasr will explain the whys and the wherefores of it to you. I'm sure that I'm going to learn a lot too. He's the most brilliant MD I've ever known in my life, and I've spent all of my working years in the medical profession. He was a biochemist. He came to the United States, got a PhD in biochemistry. Then he went to the University of Guadalajara. He received his MD. And then he was just a practitioner who would listen to him. So he did his internal medicine residency and his cardiology residency in Chicago at Michael Reed's Theater.
No, Chicago Medical School.
Oh, Chicago Medical School. And meanwhile, the biggest surprise waiting for me if you've never heard him before. May I please present and give a warm Wisconsin welcome to Dr. Mohamed.
Thank you. Thank you very much. Good evening. Hi. I just started preparing the lecture, as I said, in the last minute, and I had in my mind other lecture besides this, telling the truth. I had other plans in my head, but actually the lecture I had planned for tonight, which I will speak about that, there is no problem. It was all brain problems, not just the headaches and the strokes and dizziness and vision. These were just examples of the multiple diseases I'm going to speak about. You follow me or not? When I prepared the lecture a few minutes ago, and the briefcase wasn't open, so I prepared it this morning and it wouldn't, so I have to do it again. I had in my mind to talk about all things related to the brain, not only headaches and stress and dizziness. I think we're going to be talking about these and a lot more important things such as memory loss, for example, that I think it's a lot more important than headaches. And headache also we're going to be speaking about, but memory loss is probably one of the most, have you finished? Oh, okay, good. I got approval. Other things with the memory losses, we have to speak about diseases like occurs in the brain, such as dizziness, imbalance, vision problems, headaches also. We have to differentiate between problems inside the brain from problems coming from someplace else from the body. And the thing is about the brain is, first of all, this is the second time in 25 years I speak in nutrition, I spoke about brain diseases to the public. The first one was about a week ago in a private lecture I gave at my horse farm to a group of senior citizens. They come in every month, and then I give them a lecture there. And we usually have about 10, 15 people who sit down on Sunday morning and discuss something. And that we have over 150 people. And thank God it was 62 degrees that day. It wasn't as cold as now. But I realized after I gave that lecture that day, there is a lot about brain I can't speak about, and there is a lot about brain I should tell the people. And also, something very important about the brain, contrary to what we were told, that brain problems is irreversible. I found this through my 20 years in practice that most of brain diseases are reversible, and it can be corrected. It just is a matter of time only. And certain parts, of course, if somebody lost a half of their brain, it doesn't come back through accident. However, the brain has a tremendous capacity to generate and retain and protect itself. To be able to speak about the brain, I'd like to by explaining to all of you the anatomy of the human body. How is the human body made? The human body made from the skeleton, which is made from bones, which we have shown that in many lectures before. That skeleton, which have bone cells in it, have a specific function, and those functions is to support the body and make blood, and to defend the body against infections and so on. The body is covered with a skin, that the job of the skin is to protect the body and get the people to like you or dislike you depending on the color of your skin. And this skin also made from lots of cells, and those cells also they have certain functions. Then we have inside the body the digestive system, which starts from your mouth, so a tank can right here called the stomach, and then goes all the way to the rectum, connected to the liver, connected to the pancreas, made from many cells, and the digestive system also has its own function. Then we have the respiratory system, which is the two lungs right here. They're also made from cells, and they need certain nutrients, and they have certain functions. The reason I'm doing the body first, then the brain, to show you that every organ in the body under the master control of the brain. The brain controls everything underneath it, okay? So this is why I'm starting from the bottom, we go into the brain. Then we have the kidneys right here, also made from cells, and those cells, they do their own function. Above the kidney, there are two glands called what? The adrenal glands, which they control the hormonal system of the body, the way the blood pressure, control the way you feel, make you wake up, make you go to sleep, control everything, and those adrenal glands also have their own function. Then we have the ovaries right here and the testicles right here in men and women. These made from cells also, and they do their function. If we talk about the human body then, we talk about the body made very few organs. It's made from the bone, the skin, the lungs, the respiratory system. Then you have the kidneys, you have the glands, and that's about almost it. These organs, the way they work, they have two connections. One connection every organ has from blood going to it from the heart. There is blood coming to it. And the other connection, there is a nerve coming to it from the brain. Are you following me so far? Okay. These cells, all the cells you see in front of you, they require only one thing to function. They require a blood circulation to come to it. That's mandatory. With food, such as protein, carbohydrates, and fat, vitamins, water, minerals, and oxygen. That's all the cells of the body need to stay healthy. Then they manufacture whatever they're supposed to do. If this is supposed to be a bone cell, it's going to manufacture red blood cells and white blood cells. If this is supposed to be a kidney cell, supposed to manufacture vitamin D1 and supposed to secrete the poisons out of the body. If this is supposed to be an ovary cell, supposed to get the food and secrete estrogen. If this is adrenal, supposed to get food and secrete cortisol, adrenaline, and noradrenaline, and aldosterone, and all the other hormones, and so on. So they share only one thing. They have to get the blood with the nutrients to give you a result. You understand that so far? Okay, for the body to function right, there is a master organ right here called the brain. The brain is enclosed in a skull, which is made of bone, and is divided to several organs. They are divided to several sections. Okay. The brain, if we magnify it, we find out that if you look at the brain from the front, you find it looks like this. It has two halves, the right side and the left side of the brain. And they're connected with wires in between in the middle. If one fails, the other can take over. If one side fails, the other can take over with difficulty, but it can do it. You understand that so far? This brain cell, if we look at it from the side, we find that the brain looks like this. It has parts, different organs like that. If we take this brain and put it inside the skull, this is what the brain looks like. First of all, one part looks like that, another part looks like this, a third part looks like this. If we put the skull around it, we will find that this is what the brain looks like. Of course, this right here comes a little bit down in an angle like that, and this is the brain cells. If we look at the brain, we find something about it unusual. If you cut through the brain, you don't see brain tissue. It doesn't have blood in it. You see circulation. There is blood circulating inside the brain, but the brain cells themselves don't have any blood, just like the joints. And you find out that each section is specialized in different things. To understand the brain function, we have to go back to childhood and see when a baby is developed inside the mother, how does the brain develop? First of all, the child develops from an ova and a sperm. They make one cell. The cell multiplies and becomes 2 cells, then 4 cells, then they become 8, then 16, then 32, and it gets bigger, and finally we have a sheet like this of piece of looks like a paper called a human fetus. This sheet is connected to the mother inside with a placenta. And if we have a picture of a mother right here, this will be the stomach right here, this is the breast and the rest of the body. So this is the uterus we are in right now. This sheet of the paper folds around itself like that, and then it looks like this with a hole in the middle. This is how a human being develops. Then, immediately, this area right here starts getting twisted around itself and getting smaller, and this area right here, it becomes like that. And very soon, after approximately 12 weeks of pregnancy, then we have a body that looks like this. There are some cells right here, and there are some cells right here, but there is a cavity in the middle right here, remember, inside all of that. The cavity is connected to the cavity in the head, which the beginning of it right here, this here twists a little bit to the side and connects to the one here and form the digestive system. Are you following me so far? It's the same hole, just bend a little bit, just like a piece of paper, right here, just like any piece of paper, that bends like this, and this is the mouth, this is the rectum, and when it bends like this, around the cell, it goes in an angle then, and the brain sticks in the top right here. That's how the brain develops in the fetus. If we don't understand human neuroanatomy, we don't understand how to cure brain diseases. And this is why physicians who take years and years in education learn more. They call the specialists like us. We have easier time than somebody who's in the dark all the time. This fetus then is just connected to his mother. The brain starts developing, and pretty soon the organs inside the body start developing. And here we have the heart developing, we have the liver, we have this, we have all these organs. In the meantime, we have a brain cell develop, another brain cell, and so on. These brain cells, they start to look different from the other cells. A regular cell is very small. A brain cell is very small, but brain cell is very long. One brain cell will start cave again or maybe wake up. But we're not going to be able to repeat what I'm talking about because we have lots of things to cover tonight. The brain cell then starts in the top of the brain and goes all the way down to the organs. So if we look at the cells, we find them coming down like this from the brain and going to the heart, going to the lungs, going to the thyroid, going to the liver, going to the pancreas, going to the skin, going to the arms, to every place in the body. We call those are the nerves that they control the body. Is this clear so far? Now, the message coming from the brain to tell the organs to work, and finally the baby heart starts pumping when the brain cell of the baby tell them start working you on. And then the heart will start pumping, and the stomach will start working, and the lungs start to get ready, and all of a sudden the fetus comes out of his mother, and once it comes out of the mother, and all of a sudden we have a pregnant mother like this, with the baby is sitting right here. This is the body, and this are the legs right here, and this is the arms and the placenta, and this baby right here comes out. Once the baby comes out, the lungs, which is collapsed lungs, and the heart, which depends on the mother placenta, have to start working on their own, right? How do they do that? Why do they work on their own? Who tells them to start working? Who tells that baby, not even a human being, animals in the wild, that drops in the ground, all of a sudden starts breathing, starts standing, starts walking, starts milking by themselves? Who does all of that? Is the brain. Does all of that. So you can imagine then how small is the brain, but how significant the brain is to the human body. You cannot enjoy one day of your life if the brain is not working. That's true or not? You can have the biggest body, the best health and everything. If the brain is not functioning, then your life, actual quality of life, is finished. That's what differentiates us from animals, that most of the time animals, all they do, eat and drink and multiply and sleep. Human beings always looking for something to do and imagining always to do new things. And one of the things that it has to work very fine is the brain function. If we look at the brain then, I think it's through that way. All right. Huh? Okay. If we look at the brain cells, we find out that the anatomy of the brain, if you look at the brain from above, and you'll be able to take a picture of the brain, you'll find a picture of the whole body inside the brain. For every cell, for every part of your body, there is an area represented in the brain. For example, right in this middle area right here, you will find this cell right here will move anything. This group of cells will move anything in the head, the ear, the mouth, the tongue, and anything. This group right here will feel anything in the head. This group of cells right here will feel anything in the neck, will move it sideways like I'm doing right now. This group right here will feel anything in the neck. This group right here will feel anything in the chest. This will move it. This group right here will feel it. Are you following me or not? What we have here is a human being upside down. The head, the neck, the chest, and the legs right here. Representing in each side completely. One side, it has all the pictures. The other side has the same picture. And when this cell fires, right here, the mouth is supposed to open, the mouth will open. Because the cell which right here has a long tail, and it comes out like this, and is connected to the tongue. That cell next to it, connected to the eye. That cell connected to the nose. These cells connected to different parts like this, and you go down, you find out follow me. How many nerves you think the brain has? I'm going to give you the anatomy of one single nerve cell. One nerve cell, here is a regular cell of the heart. Very tiny. If you take 10 million of them and put them together, it will be the head of the pin. Very, very tiny. 10 million of these cells you barely can see with your eye. We look at the nerve cell. It has also the same thing. It looks a little bit different. It looks like this. Okay? So some of you study a little bit anatomy. You might like to look at it the same way you study. It has a long tail. Starts from here, goes all the way down wherever it's going. And in the end, it has a foot. In the end, there's always a muscle. Nerves always end, almost always, not necessarily, but most of the time, ends by muscle. So they can move the muscle. So suppose this here is my arm. And this is the arm muscle, and these are the fingers. And I put my hand over a hot plate. This thing is hot. There is a nerve cell right here with the head down here and the tail in the brain. You follow me? The head starts right here. The head of the nerve cell felt the heat under the hand. It sends a message to the brain to tell the brain there is a danger, there is a hot plate. The message to the brain, it travels with a speed of approximately 25,000 miles per hour. And then, once the brain gets the message, it's almost instant. Immediately, the brain feels, is this something nice, warm, or something very cold, or something very hot is dangerous. If it realizes this is something very hot, it sends a message through the main nerve cell to the muscle to tell the muscle, contract and pull the arm of the hot plate. This is how the nerve works. The nerve cell, all it needs is what? From outside. All it needs is food, protein, carbohydrates, and fat, vitamins, water, mineral, and what? And oxygen. Through this, it makes a tiny chemical called acetylcholine vinegar, which is the same like vinegar with amino acid called choline together, and it makes this tiny chemical and sends them through a canal all the way down, and when it secretes them in the muscle, it burns the muscle because acid burns. When it burns, it generates electricity. When it generates electricity, you pull your arm very fast. You understand how the brain communicates with the body then. So a brain cell is different from a hormone cell, ovary cell. It doesn't manufacture a hormone. It doesn't manufacture anything except manufacture chemicals all the time. Inorganic chemicals or organic chemicals. Sometimes manufacture adrenaline, sometimes manufacture no adrenaline. This nerve cell right here, if you count how many cells coming out of the brain, going to the body, this is the skull, through a tiny hole as big as my finger, all this nerve goes through in the middle right here of the skull. Just right behind right here, this foramen magnum, which is maybe half an inch in diameter, how many nerve cells coming through that? 200 billion. 200 each wire has to have liquid like a small tiny pipe. It has to be a pipe. All of this, you can imagine how tiny is the pipe to have 400 billion pipes in half an inch. And all of those pipes, if they touch each other, they will make a short, electric short. And each one of them has to be insulated from the other with a substance called what? The myelin sheath. Because if it touches, two nerves touch each other, you might mean to move your head, but you move your leg instead. Or you might need to say a word, but you say another word. When the nerves start having problems touching each other, that created lots of problems. We call them diseases of the nervous system. You understand now how the brain works. When we look inside the human brain here, a little suppose in front of us here is a baby just being born. For the first time, he opened his eyes, and right here is the brain of that baby. And right here, his eyes. First thing, the baby when he is born with senses. The eye for vision. What other senses he is born with? The smell in the nose. What else? The hearing. Right here, what else? The taste. Buzz right here, which only certain taste he is born with. What are these tastes he's born with? He's born with sweet and salt and acid and bitter. He's born only with certain. He can taste bitterness and identify it right away. He can taste sweet and sour, and each part of the tongue is a mess. So when we take somebody's tongue in front of us, when I want to check the tongue and see part of the brain, we can know exactly where to put the sweet and salt and the sour, and the person will taste it. But if I put the sweet in the wrong location, the person will not taste it. It has to be in the proper location to taste it, because only certain cells in the tongue taste that. The acids in different locations, the sour and everyone. When people have a stroke, that's how we tell. We get them to close their eyes, we take the tongue out, we get the bottles of salt and sour, we touch the tongue and say, tell me what you tasted. And then we don't tell him what we put it on, and then when he fails to recognize the taste or the smell or the vision or the hearing, we call that a massive brain damage or brain disease. Here's a baby just being born, and inside his mother, the only voice he hears when she was pregnant, he hears the voice of his mother. He is born to recognize her voice. Only her voice, nobody else's voice. Because he hears it through her stomach. He hears it through the skin. And when he opens his eyes for the first time, and the first thing he sees is the breast for food of the mother, or the bottle, he looks at it, then the picture of that breast will go inside through a nerve, right here, runs through all the way from here, all the way to the back, called the optic nerve, and it goes all the way to something called television screen. There is a TV screen in the back right here, and if somebody hits you in the back of the head, you see flashlight, because it reverses the light in the back. The light here is in the back. Everything goes on in the back of the head right here. If somebody gets hit on the head, he cannot see in front of him. The television screen will have a picture upside down of the breast. Then the TV screen will send a message to the memory center right and the memory center would answer, no, I have not seen it before, then this center tells the center, okay, print the picture looks like this there. The baby then starts recognizing that this is a good source of food. And he wants some food, so he likes that. Until he gets educated later on to name it a bread or whatever, or a bottle, whatever. He doesn't know the name of it, he doesn't know the shape of it, and what it does to him. Suppose this, he sees his mother coming. Then he sees a picture right here of the mother. The detailed picture of the mother, her eyes, her nose, and her legs and everything, it goes inside and it goes right here, upside down. Then the center sends a message to that center, memory center. Tell us, have you seen this person before? No, I have not seen him before. Then he said, okay, print the picture there and keep it there. So everything you see, it gets printed in the memory center. Everything gets printed there. Until you recognize it, once you learn what it is, that becomes a part of permanent memory of that day. Once you see that person again, then you recognize that person again, because the memory center knows where it is. Are you following me so far or not? Now, the next day, something else. He saw somebody else. Next year, he starts learning how to read. Next year, he starts learning how to write. Pretty soon, he starts learning new things and new things and new things, and the newer things end up, and the little and the old memory starts getting smaller and tinier like this. The newer memory in large figures, and the older memory in tiny, small figures. Are you following me? That's why it's easier to recognize something you have done 1 hour ago versus something you done yesterday, and it's more difficult to remember something you did last week, or more difficult to remember something you did last year. However, the baby, he has a photographic memory, what he sees, what he remembers, and they have very intelligent memory. They can see something, they remember it right away. The way we remember things is when we see it again, we remember. But we don't have to see it to remember. We can activate center right here. You can be sitting down, a baby can be sitting down, and hear the voice of his mother and remember what she looks like. Because in the memory center there is a picture of her. And the picture will be recalled on the TV screen. Once the picture is played on the TV screen, that's the memory reoccur again. Do you understand that so far or not? Well, this is the most difficult science called the brain science or neurology or neurophysiology. And that's the easiest way I can explain it to you. The problem with this right now, when we start having problems in the brain, we can have serious problems. If somebody hits this nerve and cut it right here, the person gets blind. If somebody punctures the ear, somebody can get deaf. Somebody damages the nose, so the senses can be disturbed, and if the senses can be disturbed, the person can die. Because if he cannot see, if he cannot hear, if he cannot feel thirst, if he cannot feel hunger, then he dies. So this is why the brain is protected with a skull, which is a bone. Underneath it a liquid to take the shock if somebody hits you on the head or something, so it doesn't get transferred inside the brain. How does the brain tell us that if something is wrong? How does the brain do that? The only message the brain can communicate with us is through pain. Through pain. The brain doesn't know how to communicate any other way. If there is something wrong in the eye, you need glasses, then you're going to have pain in the eye centers inside. If you have a toothache in the mouth, there is a pain in the tooth center in the head. If there is a heart attack in the heart, there is a pain in the heart center in the brain. All the pain always in the brain, but you feel it outside here when the brain tells you what it is. Once there is a problem occurs, it goes to the brain releases the pain signal, the nerves come out called the pain nerves. There are nerves for feeling, for touch, for vibration, and for pain. There are nerves for cold and hot. So there are many nerves coming. The nerve which is specialized for pain starts throbbing. And it depends where the problem is. If you broke a finger, then you feel it in the finger. If you have a heart attack, you feel it in the heart. If you have a sinus headache, you feel it in the sinuses. But if you don't, what happens then? If you don't have anything localized, but inside the body itself, there is a problem inside the body itself. How does the brain react to tell you something wrong inside? Besides the pain, there is something else called dizziness. If the brain cannot tell you where is the pain, it can make you dizzy. There are organs in our body there is no pain. Right or wrong? There are parts of your body there is no pain at all. Like what? Anybody knows any organ in the body doesn't have pain in it? The intestines. They have only certain types of pain, but if you cut through the intestine with a scissor, there is no pain. During surgery, when we cut, there is no pain. But if we put air in the intestine, there is pain. The lung doesn't have any pain. The uterus itself doesn't have pain. But it can develop pain if there is a problem in different parts of it. The organ that gets bigger and smaller doesn't have any pain sensation. Because if it hurts to breathe, we will have pain every time we take a deep breath. But we go like this, but if you stretch the skin, you will have pain. If you stretch the joints, you have pain. If you pull the hair, you have pain. But if the lung expands, there is no pain. Because these sensors have different way of telling you there is a problem. Suppose you have intestinal problem. You have infection in the intestine. Then you get lightheaded, you get dizzy. When you have cramps, you get lightheaded. The body tells you there is something wrong. When we're dealing with problems in the brain, we're dealing with two kinds of problems. Problem in the brain itself, the brain cells something went wrong, such as vision problem, hearing problem, taste problem, sensory problem, or we're dealing with problems outside of the brain, inside the body. To be able to identify and differentiate one with the other, it is very difficult for the regular person to do. For example, a headache. You're talking about a headache. What causes headache? This is the skull right here. This is the nose. This is the eye. What causes pain in the head? Called the headache. Problem from the body or problem in the head. Right? What problems in the body can give you a headache? Low blood pressure will give you a headache. Low blood sugar will give you a headache. Low salt will give you a headache. Low potassium will give you a headache. And anytime there is dehydration, you will have a headache. So anything when the vital signs get endangered inside the body, then there is a headache. What makes a headache inside the head or outside of the head? Outside of the head, a vision problem. sinus problem, ear problem, bone problem like arthritis of the neck, or we go inside the brain. What causes headache inside the brain? Anybody know? Inside the brain, if you have a brain tumor, if you have a leaking aneurysm, is rupturing, bursting open, if you have a fracture, if you have infarction, if you look inside the head, this is what you see coming out. This is the skull right here, and inside the skull, through this tiny hole, there's two big arteries coming with blood. When these arteries come in, they join each other, and there is a lake right here called the Circle of Willis, or Willis Lake. It's a pool of blood in the base of the brain. It's a big area with turbulence blood moving in a very high speed. Out of this lake, arteries go in the front, called the front artery, which supplies the front part of the brain. The middle one, which supplies blood to the middle part of the brain, and the back one, which supplies blood to the back part of the brain. The brain cells, to live and to function, they need food. What is the most important food out of all the food we talked about? Protein, carbohydrate, and fat, vitamins, water, minerals, and oxygen to the brain. What is the most important nutrient to the brain? The most important nutrient to the brain is glucose, sugar, plus oxygen. Glucose plus oxygen generates electricity plus carbon dioxide. And this is how the brain works. This is why low blood sugar is a very serious thing to a brain function. When the blood sugar gets low, for any reason, you feel it right away in the head. And most of you have a low blood sugar, and you know how it feels like, right? When the blood sugar gets low in the brain cells cannot function, then the vision gets blurry, the memory gets disturbed, and the whole brain you cannot think clearly, and you start sweating, you start having craving for sweets, and then you start saying, well, I better take a nap or eat something sweet. That's called hypoglycemia. The brain cells then depend on circulation. This circulation has to bring protein, carbohydrate, and fat, vitamins, water, mineral, and oxygen. If we want to study why somebody loses a memory, why the memory center is not communicating with the body, we find out that if something happens to the brain cells and the nerves when we get older. This is what happens to the nerves. The nerve cell from the memory center is supposed to look like this, and it has a tail. It's connected to the TV screen behind the head, so you can remember the old stuff and bring it to the TV screen back. Are you following this or not? The memory is always there. Memory never disappears. Never. Everything you saw all your life is always there. Even in a stroke, you don't forget. Even memory lapse, you never forget. Memory, it never disappears because it's stored in this center, unless the memory center gets cut off by surgery or something like that. This is what they do to some of the criminals in jail. Some of the criminals that they have tendency to kill women, kill children. Some doctors in the older time, they have actually operated on them and removed the memory center from them and released them back into society, and they don't remember they ever committed a crime, and they just live very peaceful life. We're not saying this is the way we should do it, but we're saying we should learn something about memory. It never gets lost. So if you have a person that, or you yourself, don't remember remember what you did yesterday, or last year, or the year before, it is because that nerve has lost some of the myelin sheath around it, and it's drying up in several locations. Once the nerve is drying in this area right here, the electricity cannot go through to the other side, right? Once the electricity cannot go through, then you cannot remember that thing you're trying to remember. If there is a nerve cell like here connected to the arm, and you have a stroke, right here, the person developed a stroke in this location. That stroke would affect this nerve right here, and that person cannot move his arm. Have you seen people with a stroke? They cannot move certain parts of their body. We were told in medical school that once nerves are damaged, they cannot regenerate. And we find that not to be true. We start watching people who have strokes, and we give them physical therapy, and we find out that it's fun. Have you seen people with strokes? They get better. The movement comes back, the sensation comes back, and their memory comes back. Have you had any friend who had a stroke and you notice that? Why? How did it happen? How do you think what happened to them? And new nerve cells have grown to connect to this, to bypass the area that's been damaged. And the nerve can grow, can become new nerve. Good example to that is when we have people lose their arm, we go and look, we find the arm, we bring the arm back after 6 hours, and then we connect it back again, and the nerves start to grow back again. So we can say fairly good that the human body is a very well-made machine, includes the nerve and can regenerate itself. What do we call the disease when the nerve gets damaged by age? Here is a nerve cell, looks like this, and that cell, due to a chemical you get exposed to, dies in different locations. Or infection, like polio, it dies in different locations. Or radioactive substance, or vitamin B12 deficiency, it dies in different locations. What do we call the word dryness in Latin? Sclerosis. And then if we multiply this, in many areas we call it multiple sclerosis. So multiple sclerosis is a disease every one of us has. Every one of us must have some nerve cells that dry up. And then, because for some reason or the other, that's what happens. Some of us are less fortunate than others, and we have more cells dying than other people. We call that multiple sclerosis in people. But another group of people, they have what we call the whole spinal cord in the back right here, groups of nerves together, they die in groups. We call that ALS, or amyotrophic lateral sclerosis. And ALS is another disease similar to multiple sclerosis. Another group that you see somebody with the hand shaking like this. Have you seen that? The nerve that stabilizes the hand, it is not communicating with the brain, and then the hand is shaking, and the person shuffles their feet slowly because they don't know where they're going, because the nerve is not communicating with the brain. When I studied all of these diseases, we find even it is very difficult to show a person with multiple sclerosis or a stroke or ALS or Parkinson heart attacks and all of that, we find that the person is patient enough and continue to remember that the brain can regenerate, they start to recover. I started practicing that about 10 years ago. When I started seeing one patient came to me with blindness. And she might be here in the room, I don't know, that person started having the blindness and losing the vision. And she came to me, and she's young, and she said, I'm losing the vision, I have optic neuritis, which all the names you hear, the fancy names in medicine doesn't mean anything. Because most of the time, it means just the name of the disease itself. Optic neuritis means that the nerve in the eye is dying. And I start thinking about what could it be? What can I do to that person to help? I felt the following. I said, well, first of all, she has to eat properly. Then we have to give her the protein, carbohydrates, and fat, vitamins, water, and minerals. Well, okay, she did all of that. She has to exercise to get oxygen. We give her that. We check the digestive system, and we find out the digestive system is not working right. And she is not digesting and absorbing her food. Then, what I did, I gave the food directly in the bloodstream. And when we did that directly in the bloodstream for about a period of 2 weeks in the hospital, all of a sudden the vision starts coming back. And here I am, internist, just finishing medical school and treating one of the most difficult eye disease called blindness, when the person coming from the best ophthalmologist in Milwaukee area been treating her and telling her, well, she's just getting blind. But I believed in me with my knowledge in biochemistry and medicine and my belief that healing comes from above. If you have to believe that you can heal, and then somebody has to heal you, also an opposition we don't heal anybody. All I have to do is support the body with the food to that brain and see what the brain going to do. And the brain starts responding. We were given that time, this was about 1981, we were given like 30,000 milligrams of vitamin C intravenously every 8 hours. That is, if you take the capsule, 500 milligrams, how many capsules will be right here then? 60 capsules equal to 60 tablets every 8 hours. And in the bloodstream. And the reason I did that, because I read an article for somebody in Japan, a scientist did it, and he said, well, it helps. So I said, well, what's going to hurt for me to try it here in the United States? So I was one of the first people. I started pushing the vitamins intravenously in very high dosage, putting my license on the line, because once you try experimental drugs and the medical society don't like you, all they have to say, you are using experimental drugs, we're going to take your license away. And that's what exactly they did. They tried to do. 6 months later, a year later, I have tremendous good results with multiple sclerosis, with this and this and that. And then I start hearing the noises from my colleague doctors. This is not approved treatment, this vitamin is not approved, nutrition is not accepted, only drugs and surgery. And I say to the hospital administrator, I really don't care what you say. I'm going to do what I believe I want to do. I was the head of the department of cardiology and internal medicine that time, then I resigned. Then I went to practice my own in Lake Valley. In a small building, I just opened my clinic and sat down by myself. Then I continued to practice. Pretty soon, the doctors in the area, they realized 6 years writer right now, they're referring patient right or left for consultation. What can you do for this? What can you do for that? There is no magic about the human body. The only magic thing about the human body is give it what it wants, and it will give you results back. The most difficult thing we have seen in the nervous system, we've seen it with multiple sclerosis. I had a patient came in on a stretcher, and she came from Indiana. And that time, I looked at her face, and she looked like about maybe 60 years old. When I looked at the age, she's 32. And then I asked the husband, when she's a very, very knowledgeable accountant, really honorable man with a big company, I said, what's the matter with her? He said, she cannot move. Her right leg is paralyzed completely, and she falls down. We have to put her in stretcher. And also she cannot urinate. How much is a bladder hold, do you think? About 1 pint of urine. She holds 2 gallons inside her, and she cannot urinate. And she's been going to the hospital every day in Indiana. They put a catheter and drained her. Finally, they told her husband, she's crazy. And they brought her over. Then I said, first of all, I don't believe she's crazy because nobody's crazy enough to hold 2 gallons of urine. Nobody can do that. So, and in medicine, you don't find anybody do not want to feel good. Everybody wants to feel good except somebody who's gone up here and wants to shoot himself. So if we depend on the philosophy that everybody wants to feel good, and the one who do not want to feel good, we make them feel good by taking them out of their depression. They could be very depressed. Then we remove the depression, then they want to live. When they want to live, they try more. This woman, she has the will to live. We did everything on her. Everything in the book. I called Dr. Silas Morrow from Oxford, England, to neurologist. He said, I never see anything like this. She must be crazy. I called Dr. Shu, my professor in medical school, and before I called him, I said, if you say you're crazy, I'm going to shoot you. So you come here and tell me exactly what this woman has. He's a psychiatrist. Dr. Shu was my professor, and he respected me a lot. He said, it is not a psychiatric problem, but I don't know what it is. And everybody said this, then all I had to do is the same thing I did with the other woman's eye. Same thing exactly. I get the nutrition intravenously, nutrition by mouth, lots of hope, and then it took 3 years like this. 3 years in and out of the hospital, with the cost over $300,000 hospitalization, and the insurance company paid only in cost. They didn't pay by their will. They have to sue them each time to get them to pay. And all of a sudden, we did a test on her, just a immune system test, and I find out she's having multiple sclerosis. But she never had the symptoms that present with multiple sclerosis. She is treated with the proper treatment for it, and all of a sudden she was walking normal, and got pregnant and had a baby. And she never had another attack since then, until today, of multiple sclerosis. It's been right now 6 years. But other people we have multiple sclerosis also, and they keep getting attacked all the time. Another person, I'm just giving you examples here for all of you who have memory problems, brain problems, anything to do with the brain, that is a way that the brain can rejuvenate. But it takes determination, it takes a will. This person called from Iowa, which is a patient of mine. She said, I'm not feeling good, and she sounds like she's slurring. She's my patient for 6 years, and what happened, she had a stroke. She had a massive stroke. She called her doctor over there, and the doctor said, prescribe called me, the husband told me, I told her to put her on the line, I heard her voice, I told her your wife's having a massive stroke. Take her to the hospital right away, a local hospital, and get another doctor, not the same doctor. The new doctor recognized it is a stroke like I did, and in 3 months, from a woman who doesn't have a movement or speech, right now she speaks very freely and doesn't have any problems at all. So, the problem of the brain, any kind of a problem the brain has, I spilled a lot on this slide. Any kind of a problem, one has to try to understand why there is a problem in the vision, where there is a problem in the hearing, the problem in the smell, the problem in the balance, the problem in the memory, or the problem with headache. The diagnosis has to be made first. Of course, you cannot have a headache and assume it is just a sinus. It could be ruptured aneurysm. How many of you, when you get a headache, you think it's tension headache, or it's a sinus, or something simple? All of us, right? If you practice medicine like me, or like any doctor who's been in the same position, and you see people that have simple headaches, drop dead, you learn the lesson that any headache is a serious headache until you know exactly what caused it. We have a Spanish girl in St. Mary of Nazareth Hospital in Chicago, where I used to be doing internal medicine, came to the emergency room with a headache. I was on call, but I was not the doctor, I was the chief. So the doctor working for me, the first-year resident, he takes care of the patient. I'm in my room sleep. If he needs my help, I come down. If he doesn't need my help, then I stay all night sleep. So he called me. He said, I send the lady home with a headache. I wake up at midnight. I told him, what did you have tonight? He told me he got a gunshot, knife wound, a heart attack, deliveries. And he mentioned this about the headache. I said, what did you do about this lady with the headache? He said, I sent her home with Tylenol. I said, do you know what caused her headache? He said, oh no, she's one of those people in public aid that comes all the time just to get a shot of narcotics. She gets a headache so much that she goes to the emergency room, they give her morphine, get her out, and they call her a drug addict. She comes in an ambulance the same night and died that night with ruptured aneurysm. So what she had is 25-year-old lady with 3 children, and she has a leaking aneurysm above the sinuses and always mimics sinus headache. And it goes away with aspirin and Tylenol. Of course, anytime you have a pain, you can cover it with pain medication. And that's what happened to her. Whenever you have a problem right here, you have to have a diagnosis first. How would we treat brain problems? This thing is wet. Well, I have, okay. How would we treat brain disease? First of all, you have to take one of them at a time. If you have a headache means pain in the head. That's what this means. You have to find out, number one, is it infection causing it? Is it a chemical, toxic, causing it? Is it a tumor causing that? Or is it metabolic, like hypoglycemic, causing it? Or is it a circulation causing it? There are only 5 things every doctor should look at. You look at infection causing the headache inside the head, such as encephalitis or meningitis. You heard about the word meningitis. Or outside of the head, such as sinus or sore throat or ear infection. Headaches from inside the brain, they differ from headaches from outside of the brain. inside the brain almost always has with them the feeling of nausea. They have with them the photosensitivity that you cannot look at the light, you like dark. And inside the brain, it can be also from other things besides infection. It can be toxic. Toxic inside the brain. If you take a drug, that can cause a headache. It could be carbon monoxide. It could be carbon dioxide in the house, so the air is not fresh. It could be aluminum. It could be lead. It could be any kind of things inside causing the toxicity. It could be a tumor inside the head causing the headache. It could be metabolic, like hormonal imbalance, like low blood pressure, like low blood sugar, hyperglycemia. It could be also circulation, like rupture aneurysm. Or it could be blockage in the carotid arteries does not allow enough blood to the brain. When we deal with headache, these are the things the doctor has to look at. Infection, and you can diagnose it most of the time with blood cultures and virus cultures. Toxic is difficult to check, but we can experiment with vitamin E and certain nutrients to remove the toxicity and things. Tumors is diagnosed with scans. Metabolic is diagnosed with a blood test, and circulation is diagnosed with the scans, and certain equipment can do that. These are the causes of headache. The other problem is, let me be sure to cover every one of these so nobody complains. Dizziness. Dizziness is the imbalance you feel that you're gonna drop. Inside the head, there is a cup like this in the ears with fluid in it. This cup in the inside the ear, it has on it a piece of paper floating, connected to a thermostat like this, and when the fluid, if you tilt like this, the fluid comes like this goes down, this goes up, and tell you that you are going in that direction. If you tilt like this goes up, this goes down, and you feel like you move in that direction. This is called the balance. Look at you, we walk on two legs, and we know if we're going to fall forward, we go back. If we're going to go back, we go forward. This balance system right here is inside the ear. We call it the indole limb. It's a fluid. If we have an ear infection or aging of the ear, then we have lots of dizziness that it presents first with ringing in the ear called tinnitus. Instability. The first sign of dizziness you want to check, not when you open your eye, is you close your eye, put your feet together, put your hand in front of you, and see if you're wobbly or not. If you start to go sideways, this means there is a problem in the balance center, and that's what causes dizziness. If somebody is dizzy because the ear have a problem, secondary to infection, or secondary to toxic, or secondary to tumor, or secondary to metabolic or circulation, then we can deal with it, whatever the cause of it is. So, when we're dealing with dizziness, the cause of it are the same. Dizziness from infection, is it possible or not? Infection of the ears, infection of the brain can cause dizziness, correct? Toxic, gases, carbon monoxide, not fresh air, all of that can make you dizzy. Tumors can make dizziness. Metabolic, like when you have a low blood sugar, anything makes you dizzy. and circulation also can cause the same problem. Vision problems we have covered, and strokes we have covered. I would like to put some final to the lecture right now, and we're going to be taking some questions. And once we find the diagnosis of the problem, remember the symptom you have of headache or dizziness is a symptom. It's not a diagnosis. The diagnosis is what? Is it infection or a chemical or a tumor or metabolic or circulation? This is the diagnosis. And you can have two things. You can have two headaches from two sources in the same time. You can have two dizziness in the same time. Not necessarily you have one. You can have a headache from a sinus and a headache from aneurysm in the same time. So one thing very important is to check all the possibilities. Once the diagnosis has been established, the treatment has to be done. If the person has an infection, then they have to be identified. Is it a virus or is it a bacteria? If it's a virus, we give them nothing, except there is no treatment for virus, except step number 2. Number 1 is a treatment with medication or surgery. Number 2, plus with nutrition. Step number 3, removing of stress and exercise. And step number 4, detoxification, removing the chemicals from the body. If the person has a virus infection, such as Epstein-Barr virus, then we give them gamma globulin and nutrition. If they have a bacteria infection, then they need antibiotics. If the problem is a tumor related, then we have to identify what kind of cancer is it. Is it bad cancer or not very good cancer? If it is a very bad cancer, it has to be treated right away with surgery or radiation. If it is not a bad cancer, sometimes we let it go for many years and then we treat it after 20 or 25 years. If this is a circulation related, somebody has a circulation problem, we have to give them the medication to stem the blood, like aspirin or Percentil or Coumadin, to improve the circulation inside the head. If this happens to be metabolic problem, hypoglycemia, there is no medication you can give for that or surgery, then we go to step number 2 right away for hypoglycemia. Are you following me or not? All the steps have to be followed. But the first step always, the medical step. Because you take somebody with severe sinus headache, you tell him take some vitamin C, he wants that sinus infection to go. You have somebody with meningitis, we have to give them antibiotics first before we do anything else. So these are the treatments we do for somebody who has any of these problems: circulation, metabolic, tumor, toxic, or infection. Sometimes in toxic, we go to step number 4 right away. We give them detoxification, removal of the chemicals out of the body. The step number 2 with the brain problem is always nutrition. Remember that the brain did not get sick all of a sudden. Something must have happened over a long period of time. Part of it is the nutrients you eat from outside, which is protein, carbohydrate, and fat, vitamins, water, and minerals. Are you eating the proper protein? We know there are 2 sources of protein, the animal and the vegetable. Which one is better? The vegetable protein. So we tell the person who has a brain problem, eat lots of vegetable protein. But does this mean eating the vegetable protein will cure his problem? No, it doesn't. It means it's only one little help get that a lot. Somebody will say, okay, I'm going to eat I've been eating vegetables for a week, but my headache is still there. Well, this is just one problem. Look at all your life, see what else you're doing. I saw a guy in my office about 3 weeks ago from McKinsey. This man is about 38, and his ex-wife brought him in because nobody else would bring. And he divorced her, and she came to the house and picked him up and brought him to me. He was blue, short of breath, basically about to die. You ask him a question, he has to get some oxygen and then answer first. I asked him, what's your problem? And he said, I have a heart attack after another heart attack, 5 heart attacks. Well, after going through all the checkups in 2 weeks, and remember, he doesn't have insurance, Medicare will not accept them because his oxygen is not below 50, his oxygen is 51, and it's not below 50, they will not accept him. Public aid will not accept him because his oxygen is 51, it is not 60. Nobody wants to give him anything, and he doesn't have a job, he doesn't have a house, he doesn't have anything. He's just unfortunate, sick human being. That's what he is. I told him, first of all, for me, don't worry about any visits here or any tests here. Don't worry, we will do all of that for free. Fine. I don't know if I'm going to help you or not. That's my problem. To check the guy thoroughly, I did find out his problem is nothing to do with the heart. His problem is in the right heart, is in the lung. He has emphysema, he doesn't have a heart problem. I took him off all the heart medication, got him all the emphysema medication, and got him Medicare to accept him, public aid to accept him, got the pharmacy to give him free medication. His medicine costs about $700 a month. Just medications alone to get him to breathe. I saw him today walking in to the clinic. I said, you don't look short of breath. He said, no, I feel a lot better. And that's a good example that the proper diagnosis has to always be done. And the treatment was the proper medication he needed. But when I came to nutrition, he uses always this bad language in the office. He says, I don't want any of this four-letter word stuff. I said, no, wait a minute. That's in the very beginning. I said, I'm not going to waste my time with you. If you're going to continue to drink heavy and smoke heavy, don't come back here again. And I don't want to see your face in this office again. And he returned back. He stopped drinking today, he stopped smoking, and he started exercising. Here is somebody smoking 90 cigarettes a day, drinking over 12 cans of beers every day, a true alcoholic, stopped drinking on his own, without anything, when he saw death close by, and he saw hope in the horizon. You see, in the past, he didn't see any hope. He was told, you're about to die, you're about to die, you're about to die. Then he said, who cares then if there's no hope? I give the guy hope, find out his problem, get him, he came with 7 heart medications, he left with 14 lung medications. So he left with 14 medications rather than 7, but the 14, every one was for something specific. He had a fungus in the lung we had to kill. He had a bacteria we had to treat. He had all kinds of problems. Every little problem has to be treated, and we hope by next week or the week after we take him off most of the medication. We keep him on 2, 3 only. But that shows you that diet plays a big role. He came today and he said, I thought the vegetable and the vitamin did it. He asked me today. I told him, no, it's the medication did it. The vitamin didn't do it. But the vitamins will come later on. The carbohydrate we talked about before. There is the simple carbohydrate and the complex carbohydrate. Give me some examples on a simple carbohydrate. Sugars, no, potatoes are complex. Sugars, right? Natural or not very good to eat all the time and drink all the time. Even the body likes it. Remember, the body likes the bad stuff most of the time. Like animal fat, like the sweet, like the fat, the saturated fat from animals, not vegetables, right? We like this stuff. But you think about it, is it good for us or not? And that's the problem. Carbohydrate, the complex carbohydrate, is a lot better than the simple carbohydrate. Fat, we talked about that also. Fat, actually, one of the most beneficial things for nerves are fat. Oil. Oil is one of the best things you can consume to improve the nervous system. Because the fat is polyunsaturated fat in oil. The polyunsaturated fat, it has lecithin in it, and lecithin is one of the best nutrients for the nervous system. Vitamins. Are vitamins important to the brain disease or not? Is it important or not important? If one at a time. If the brain disease secondary to infection, which vitamin will be very important? Vitamin C and the rest of the vitamins. If it is toxic, which vitamin is the most important? Vitamin E and the rest of the vitamins. If there is a tumor cancer, which vitamin is the most important? A and the rest of the vitamins are also very important. If it is metabolic, then it depends. If it's hormones, then we're dealing with E. If it is the hypoglycemia, we're dealing with C. It depends on what kind it is. If it is circulation, which vitamin is the most important vitamin? Vitamin E and the rest of the vitamins. So when we're dealing with role of vitamins in nervous system, they're all important. And to stay safe, just take some of each. Water. Is water important for brain function? If you don't believe it, go to Arizona and get hot, get dehydrated, and see how your brain will work. The brain doesn't work when it is dehydrated, right? When you have a heat stroke, you don't think very clearly because the brain needs lots of water. Minerals, also very important to brain function, especially trace minerals, and all of them actually important. We leave the nutrition to go to this section right here. To remove stress on the brain is the best thing you can do for the brain. The brain is the only, one of the very few organs in the body, actually the only one, completely go dead, almost go dead 100% when you go to sleep. When we go to sleep, and you look at this brain right here, take one of these guys right here, when you are awake, you can see, you can smell, you can hear, correct? When you go to sleep, you cannot hear, you cannot see, you cannot smell, right? Unless somebody wakes you up with a tremendous noise, normally you are half dead. Have you seen children, you open their eyes, people will open their eyes when they sleep, they don't see anything. How do you explain that after deflection? How do you explain that? What happens is because inside the brain there is a switch right here, a big switch, we call it the reticular system. The reticular system is a like transistor. It shuts off at night when it gets exhausted. The brain lives on a substance called dopamine. It's an amino acid called dopamine. Dope. The word dope means drug. It lives on dope. Substance called dopamine. And it makes this dopamine inside. And it uses it through the daytime. When it runs out, it shuts at night and it rebuilds itself for next day. And when you go to sleep and the vision is no longer working, but you see a dream. You have a dream and you can see people. How easy you can explain that then? How easy to explain it? Very simple. That the memory center, when this shuts off, the memory center and the TV screen are communicating all the time between each other. And the thoughts and ideas are very erratic and very unorganized. This is called dream. And the dream always comes from something you have to be there first in the brain. You could not dream about something never existed. Are you following me? You have to have seen it, heard it, felt it to dream about it. And if you did not, there's nothing called imagination. And in experimental trials, they have connected electrodes inside the brain in monkeys and connected it to a TV screen, and they were able to reproduce the picture going up in the brain on the TV screen during that time. But it was very unorganized. During sleep, the brain rejuvenates itself, reorganizes the wiring, rebuilds the broken areas, the dry areas, the sclerotic areas, rebuild the body sheet because you had an injury, you hit your head, you did this, you did that. All of this happens at night. When we have stress through lack of sleep, too much depression, unhappiness, anything that makes the brain work all the time, the brain gets exhausted. When the brain gets exhausted, then a disease will develop. So nutrition alone, deficiency, will cause disease. Also stress can cause disease. Most of the stress is internal, from inside the body. Some of the stress are external. So through getting rid of stress by having 8 hours sleep, and the person who says, I can do with 6 hours, maybe some people can do with 6 hours sleep. But the more the brain works in the daytime, the more it needs rest at night. You understand that or not? So a person that the brain didn't do anything all day, well, they need 1 hour sleep. And that's more than enough. Where a person who their brain thinking all the time might require 12 hours sleep because they're extremely exhausted. Brain exhaustion is more serious than physical exertion. A physical exertion, fatigue, you lay down, take some juice, take some vitamins, rest, in a couple hours, you're ready to go again. But brain exhaustion, it depends what part of the brain is exhausted. How many centers, how many cells, and all of this we have to get rid of. Sleep is one of them. And meditation is another one. Exercise is excellent of getting rid of stress in the brain. Why exercise helps the brain? Oxygen alone, no. If it's not oxygen, it helps the brain during exercise. As a matter of fact, it's not also circulation. As a matter of fact, actually the brain has less oxygen during exercise because it has more carbon dioxide produced in the blood. Because the human body cannot have two stresses in the same time. You cannot have mental stress and physical stress in the same time. Only one stress will dominate, the physical or the mental. You understand or not? If you worry about something and exercising, you still worry. But if you exercise, if you put your stationary bike on treadmill and 15 miles an hour, and you are about to fall and you're by jogging, you're not thinking about anybody else except yourself. And the stress in the brain goes away during exercise because diversion. This is one of the biggest benefits in exercise is you get your mind on something else. Maybe you play music during exercise. Maybe you watch something or do anything during exercise that helps the brain. Vacation help to get rid of stress. But stress happens every day. Then you need a vacation every day. Okay, but what kind of a vacation you're going to have every day? That's called certain times of the day, called a vacation time that you spend it to get with yourself, called meditation. A vacation intended to be a period of time for rejuvenation. You look at the people going on vacation to Hawaii, for example. I said that in some lectures before. When they go on vacation, they look very happy. When they're coming back, they look very exhausted. So a vacation not intended to hurt you. It's supposed to, you're supposed to feel better after the vacation, not feel worse. When we talk about sleep, I want to go back to this again because it is very important for everyone here to remember sleep intended to be a period of time that there is no noise affecting the ear, so it shouldn't be any music or noises, shouldn't be any light disturbing the eye, it shouldn't be too hot or too cold, and also sleep without dreaming means it is not good sleep. If you don't dream, this means that the brain did not shut off completely, means you're still alert, means you're sleeping on a train or an aeroplane, which you really not sleep subconsciously, you are awake. You be on the plane sleep, and the moment the dinner time comes, you are awake. Or you land after you have 12 hours in a train or aeroplane, you're more tired after you slept the 12 hours. Have you been on a train and felt that way, or an aeroplane? Because that's not really a sleep. Your muscles relaxed, that's true, but your brain did not. Detoxification is the process we use to remove chemicals from inside the body. Because in our society right here, we find the following things affect our health. Besides what we have seen in all the factors affecting us, we find that the amount of chemicals in our food have gone up like this. In our air have since the year 1900 until 1989, and all these chemicals in the air and the food and the water causes problems inside our body called toxicity or poisoning. From radon gas to carbon monoxide to ozone to 26,000 chemicals in our food that causes problems, to drinking water that's full of fluorine and chlorine and all kinds of junk in it. We are exposed to all these chemicals, and we have to detoxify the body. How we do that? Once we identify the chemicals, we give more of vitamin E to detoxify the water-soluble chemicals and vitamin C, or we give EDTA to remove the lead and aluminum and arsenic from the body. So to try to achieve a treatment to that diagnosis, one has to understand it's not going to be easy. It's going to be a long struggle by having the proper diagnosis or mini diagnosis. And remember, many times I see a patient with one problem, and we find that they have many diseases, not only one. We find the circulation in the heart is bad. We find they have infections. We find that they have poor immune system. They have a hormonal imbalance. They have arthritis. They have diabetes. And for every one of that, there is a medical treatment. There is a nutritional management. There is a stress management. There is a detoxification. And to try to help this without helping this or this or this or that, it does not achieve the purpose, because holistic medicine is the best way to practice. I'm going to take some questions for the next 10 minutes, and we'll close the lecture after that. For the people who have further questions, this is the last one. I'm going to use it right now. Well, there is one right here. I'm going to put my telephone number at the 312, can you see that? Okay, 356-9009. If you have, this is for medical consult. For questions, you dial 312-843-8860. Dr. Percy, my assistant, he's the first one to answer the questions, and there is a new doctor right now, is Dr. Drake. He's a board-certified doctor, coming from Florida next week, and he's going to join us with the prevention. He'll be under training for 2-3 months until I decide if I'm going to keep him or not. He knows that. So, this Dr. Percy is the one who answered the question, not Dr. Drake. But these are the numbers, and I'm going to take some questions from the front to the back, and it shouldn't take more than 10-15 minutes. Anybody have a question right here? Yes.
I think it's Dr. Paul. In the brain area, where does Alzheimer's treatment or diagnosis come in?
That question is, where is Alzheimer's disease developed? We don't know. When we do autopsy in the beginning, I'm going to go back now 10 years. When we did autopsy on Alzheimer's patient, we find the axon, all the pipes from the nerves, all being dead. Then we thought maybe it's infection. We thought maybe it's hereditary. Hereditary is blamed for too many things. In my practice, I find hereditary to play only 5% of the disease. 95% is not hereditary, it's environmental. We created this idea with us. In Alzheimer's, I think it is infection or toxicity or metabolic or circulation. However, when we treat Alzheimer's patients, so far with the treatment we have done with nutrition and vitamins and everything, so far we have failed to bring all the memory back with all the management we have done. We did not succeed with bringing it back yet. Maybe the patient remembers more than we think. But the way I asked him the question, he doesn't answer it properly. But those patients with Alzheimer's disease, they continue to come and they're not deteriorating as fast as other Alzheimer's disease in other practices. But the exact cause, sometimes we never know. But the easiest thing in medicine is, sometimes you never know the cause. But at least if you know your way out, that's even a lot better. And tonight, through the means of, if you just take any disease, any kind of disease, and apply the nutrition route, and get rid of stress, and detoxify the body, removing the chemicals, without any medical treatment at all, they still do better. You follow me? So it is an easy path to do. And the difficult part is to get the person who has the problem to follow such programs. And they will find every reason not to take the vegetable protein, not to eat the proper carbohydrates, not to eat the proper fat, not to take the vitamins, not to take the minerals, not to drink enough water, and not to exercise. They find every reason not to do it. And you gotta have the person who's willing to do better. And many times, if you don't have that positive attitude inside that you want to do good, you never do good. And we have actually experimented on people, find out that the people who are negative, they're missing part of the immune system called interferon. And when they became positive in their thinking, the interferon starts building up. And the interferon is a nutrient, it builds through nutrition. It doesn't get built with drugs.
Thank you.
You're welcome. Anyone? Yes.
You mentioned how the brain can heal itself. If you're dealing with a child, for instance, who has a seizure disorder, and they're talking about medication to control it. Okay, will that child have to be on that medication for the rest of their life, or should that be looked at over and over?
No. First of all, I said the medical treatment is number one. Means the medication has to be given. There is no doubt about it. The question was about seizures. Seizures are a serious disease. The problem with seizures, the thermostat that shuts the brain inside is not working. So the messages go through and the movement's jerking like that because the switch is not shutting up. And you have to close it with phenobarbital or tegretol or dilantin, otherwise they can have a seizure when they're driving, when they sleep, they can die. And we have lots of seizure patients do very well with very little medication through this program. But many of them, they still need medication. I have my own daughter. She had seizure when she was 14 months old, and she almost died from it. And she's not on medications right now because we gave her the medicine for 2 years, and then after that, with the nutrition, we felt that we should take her off the medication, but we observe her day and night. And we find out that the EEG was normal, and she doesn't have seizures, then we find out that she doesn't need the medication. But anytime she gets exhausted, she will fall to sleep very easy, and seizure patients do that. So I think seizures should be treated with medicine plus nutrition. Yes, in the back. I cannot see your hand. Yeah, yes, ma'am. You.
For regular tumors, usually you have a biopsy to tell if it's malignant or benign. How would you do it for a brain tumor in the center of the brain?
Well, in brain tumors, the shape of the tumor in the CAT scan and the MRI scan usually tell us what kind of a tumor it is. But biopsy, it can be done. And in brain tumors, the good thing about brain tumors, they respond very well to radiation, and radiation does not hurt the brain. The brain is built from radiation. That's why the human brain, radiation doesn't bother it very much. Brain tumors in the brain are the easiest tumors to cure in the human body. Any questions in this section? Anybody? Yes. Yes.
When I have a headache, my worst headache is upon rising in the morning. And that's a headache that I'll have all day long until I go to bed the next. There's nothing that will relieve me of that headache.
Again, a headache is pain in the head. It has to be investigated very thoroughly. You wake up with a headache, it can be any of the things. As long as you ask the question about the headache, the most significant headaches are headaches in the children. The younger, the worse. The problem is. And headaches in older persons over the age of 60. Because when you are 60, you're supposed to have the perfect body that everything will develop. You shouldn't have a headache. If you have a headache, there is something organically wrong. Children should never have headaches. When they have headaches, there is something organically wrong. Something bothers them. Because children have lots of energy and they don't like to complain. Once they complain, means their complaint genuine. Anybody in this section here? Have a question? Yes, in the back.
I have forms of severe emotional problems, and it's very, very rare. But my question is, you said I can mild and severe, and I can be very. I understand that this is done on chromosomes, but what about menstrual radiation?
Well, this is one of the most difficult questions I was faced with when I was in medical school. I knew a lot about nutrition. I was a professor in the medical school where I was a student in the same time. So I have lots of knowledge. And one thing I cannot answer, how about hereditary problems? And in the medical book, it says that hereditary disease are incurable. However, in other medical books it says vitamins in very high dosage, they do help mental retardation. I do believe that if you have somebody who has mental retardation, and in this program we talked about the right kind of food and the vitamins and all of that, I think you're going to have a better result. And I have several children and adults with mental retardation. They do fairly good, not perfect, but at least better than expected. You can't give up on anybody. That is the thing in medicine. You have to keep trying because life is very important to that person. Not to you, but to him is very important, and we have to keep trying for that. Thank you very much, and you have a good night.